Thank you for tuning in today to learn more about IT band syndrome. I'm Annette Monk, a student in the doctoral athletic training program at Indiana State University and an athletic trainer with a passion for helping runners achieve their goals. Athletic trainers, or ATs, are credentialed healthcare professionals who focus on prevention, emergency care, diagnosis, therapeutic exercise prescription, and rehabilitation of injuries and medical conditions. Athletic trainers work under the direction of a physician. Chances are, if you're watching this, you're a runner who's had knee pain, or you know of a runner who's had it. So let's talk more about IT band syndrome.
ITBS, or IT band syndrome, is the inflammation of the connective tissue that starts at the outside of the hip and connects to the outside of the knee. Here in this picture, you can see that it runs all the way on the outside. The IT band is not a muscle, but it does connect to three very important muscles of the hip: the tensor fasciae latae, or TFL, the glute medius, and the glute maximus. Typical symptoms of ITBS include pain along the outside of the knee during running or exercise, climbing stairs, or squatting. It's common to feel the sharp or stabbing pain at the beginning and the end of a workout. This pain comes from the IT band rubbing against the thigh bone, causing friction every time the knee is bent. IT band syndrome is common in runners, military recruits, and individuals whose job requires climbing stairs or ladders often. The main causes of ITBS include a sudden increase in training, running or walking on uneven surfaces, weak or inflexible hip muscles, and incorrectly fitted shoes.
IT band syndrome will typically resolve with proper self-care and avoidance of aggravating activities. If treated appropriately, IT band syndrome has no long-term consequences. A return of symptoms can be avoided by routine stretching and strengthening, avoiding running on crowned roads and uneven surfaces, replacing shoes every 300 to 500 miles, and a gradual progression in training volume. To treat ITBS symptoms, general recommendations include stretching 1 to 2 times a day, especially as part of an exercise warm-up. Heat therapy once a day, typically right before the workout. Massage or foam rolling every day or every other day, completed before exercise. And strengthening exercises every other day. In this next portion of the video, we will go through each section and show you proper ways to complete each one listed. Heat therapy is a great treatment for IT band syndrome. There's a couple of ways to heat, including in the hot shower, letting the water run along the length of the IT band for 5 to 10 minutes. Another option is to use localized heat with items around the house. Items can be white rice or dry beans and a long, clean tube sock. If you fill the tube sock with beans or rice, you can then tie it in a knot and microwave it for 2 to 3 minutes, depending on the microwave settings. Once it is warm, then place a towel around the IT band, preferably right along the knee where the friction is, and put this on top of the towel. Heating should occur for 5 to 10 minutes and is done right before activity or right before stretching. Massage and foam rolling is another great treatment for IT band syndrome. This requires some equipment. Here we have a massage stick, which can be purchased for $20 to $30 online. We have a high-density foam roller with plastic on the inside and padding on the outside. This one's anywhere from $30 to $45 online. And then we have a standard high-density foam roller that can be $15 to $30 online. The difference between these two foam rollers, this one's a little softer. This is a little bit more aggressive or a harder of a massage. Now, if we don't have these pieces of equipment, we can use equipment around the house. Instead of a massage stick, we can use a rolling pin from the kitchen. We can also use a bat. If we have a baseball bat or a softball bat, anything that's round that we can roll up and down. So to demonstrate this, either sitting or kneeling, knee bent or knee straight, We're going to start at the top of the IT band at the hip and roll down to the knee, applying gradual increasing pressure. And we want to put pressure on where we feel it, and we may feel soreness. We should not press so hard that there's pain. If there's an area that's really sensitive, we can localize that as well. Typically, treatment is every day or every other day for 5 to 10 minutes. With foam rolling, the treatment is to tolerance, so it can be as short as 1 minute or it can be as long as 10 minutes. I'm going to demonstrate on my right side. So with my right IT band down, I'm going to cross my left leg on top, and I can either support myself with my hand or with my forearm. I'm going to start at the top of the hip and go down, and putting as much pressure on as I can tolerate. If there's an area that's sore, I'm going to stay on that, and then I'm going to flex my knee and then bring it straight, doing this 10 times. You may feel popping or snapping. Again, as long as it's not sharp pain, it's okay to continue with the massage. Stretching for IT band syndrome should be done 1 to 2 times a day while symptoms persist, and then once symptoms resolved, can be done before activity. Now with stretching, typically we want to hold each stretch for 20 to 30 seconds in 2 to 3 sets. So to do our first stretch of standing IT band, I'm going to stand on the injured leg, my right. I'm going to cross my uninjured leg over, and I'm going to push my hips out. To intensify the stretch, I'm going to bring my arm overhead, again holding this for 20 to 30 seconds. Another stretch for ITBS is the seated glute crossover stretch. Here I'm going to stretch my right leg. With my left leg straight, I'm going to cross my knee over and pull my knee towards my opposite shoulder, again holding for 20 to 30 seconds in 2 to 3 sets. When stretching, it's also important to stretch other muscles of the thigh, including the quadriceps and the hamstrings. To stretch our hamstrings, we're going to use a chair or a stool, putting the leg up, pulling the foot towards the shin, back straight, hinging forward until we feel stretch in the hamstrings, holding for 20 to 30 seconds in 2 to 3 sets. To stretch your quadriceps, we're going to pull our heel towards our hips, and we are going to make sure our knee is pointing backwards, keeping our chest upright. If we need to, we can hold on to the wall for stabilization. While stretching is typically done before a workout, in addition to multiple times a day, strengthening is going to be isolated to every other day and after a workout. We're going to do 3 essential hip strength exercises to limit IT band syndrome. First one is clam exercises. Using a TheraBand in a loop, we are going to place it right above our knees, and we want to lay on our side with our knees bent, our ankles in line, either supporting ourselves on our forearm or laying straight. We're going to squeeze our buttocks together. We are going to keep it squeezed as we lift up, hold for 3 seconds, and down. We're going to do 20 repetitions of this in 2 to 3 sets. After I do 20 on this side, I'm going to immediately flip and do 20 on the other side. This is a clam exercise that will be done every other day. Another exercise we can do is sideline leg lifts, targeting that glute medius and that TFL. So we again are laying on our side. This time our bottom leg is going to be bent and our top leg straight, and we're going to pull it backwards as well. As we turn our toes down or in, we're going to isolate those muscles by lifting up, holding for 3 seconds, and then down, lift up, down, and we should feel it targeting these muscles. Typically, it's going to take 15 to 20 repetitions to feel fatigued. If at that point you do not feel fatigued, you can always add 1 to 2 pound ankle weights. These exercises are done on both legs and in 2 to 3 sets every other day. Another essential exercise is a one-legged RDL to target the hamstring and the glute maximus. In this position, we are standing on one leg with our opposite leg backwards. The important thing is to keep our back upright, and with our hands, we're going to slowly come down and touch the floor and back up. You can see my knee is slightly bent, but it stays in the same position the entire time. As I come back down and back up, we're going to do 10 to 15 repetitions in 2 to 3 sets on both legs, done every other day.
Additional treatment recommendations for ITBS include using an IT band strap during running, squatting, and using stairs. The strap pictured here may be purchased for approximately $20. The training plan should also be modified as needed. General recommendations include having 1 to 2 rest days per week and alternating activities each day. For example, running one day followed by strength training the next day is recommended while symptoms persist. Severe cases may require 1 to 3 weeks of complete rest from exercise. Rest is recommended when running gait is affected and the runner feels off balance. Applying a nice massage for 5 minutes at the lower part of the IT band may also be completed once per day, but typically is not a preferred treatment plan. If, however, the runner decides to ice, make sure it is done after activity only. Typically, the icing is not recommended because the IT band lacks blood flow, causing the stiffness to increase with icing. Instead, remember the term motion is lotion. Avoid sitting for prolonged periods, which will make the IT band stiff. An over-the-counter anti-inflammatory such as ibuprofen or Aleve may be used as well. Be sure to read the precautions on the label of the NSAID. Do not use if you are currently taking blood thinners or take it for longer than 7 days without talking to your physician. In severe cases where these treatments have not resolved ITBS, a physician may recommend a corticosteroid injection at the site of the knee. This requires a physician's prescription and is currently only for severe cases.
Now you are equipped with knowledge on how to treat IT band syndrome. A great resource for more information is webmd.com and use the search term IT band. As an athletic trainer and as a marathon runner, I encourage you to complete the exercises as listed and follow up with your physician if symptoms persist for any prolonged time. If you have any questions on this video, please reach out to me by email at amonk@sycamores.indstate.edu. Wishing you a happy and healthy run.